Hello, welcome to today's This is the second installment of presentations, and the third will be next Friday. These presentations are the culmination of a unique year-long leadership program funded under a cooperative agreement by the FDA Office of Training, Education, and Development. Today we will experience 3 project presentations. As for the format, the fellows have been given strict requirements to consolidate the presentation of their project into a 10-minute segment, followed by questions from the audience. If you would like to ask a question while the fellow is presenting, go to the bottom of your Zoom screen and type your question in the Q&A box. We may not get to all your questions in the interest of time, so feel free to contact the fellows by email or contact IFPTI if you would like to learn more. Well, I think we're ready to begin. So Melanie, would you like to start us off? And take yourself off mute, Melanie.
Sorry, I kept clicking it, but it won't work.
Oh, there you go.
Let me share my screen. And hello, everybody. Thank you for joining us. Titled Consumer Perceptions on the Impact of Pet Food on Human Health. States who have their own feed programs, or some do, I'm sure some may not, but a lot of them have their own feed programs that regulate the feed or pet food in the state. And then we have AFCO, the Association of American Feed Control Officials. This is not a regulatory body, but the membership is made up of state and federal feed officials who, along with other stakeholders, create model regulations, ingredient definitions, and laboratory standards that the states can adopt. So these organizations all work together to keep the pet food in our country safe. However, in recent years, there's been an increase in animal and human illness linked to pet food. A lot of pet food has been recalled lately, and a huge reason is because of foodborne pathogens found or believed to be in that food. A lot of these have caused illness and death in pets. Actually, half of the recalls in 2018 and 19 have been due to foodborne pathogens, either confirmed or potential. And as pets become more prevalent in the home, we're starting to see that the pet food can also affect the health of the pet parent or the pet owner. There have been 3 outbreaks of human illness linked to pet food in the country. In 2017, there was a multi-state outbreak of salmonella infections linked to dry food manufactured by Mars Pet Care. 62 people were affected. 31% of those were a year old or younger. In 2012, there was an outbreak of salmonella infections linked to Diamond Pet Food dry dog food. 49 people were affected, 10 had to be hospitalized. And most recently in 2019, there was an outbreak of multi-drug resistant salmonella infections that were linked to pig-eared dog treats. The investigation ended October of 2019, and there was no common distributor or region of origin that was found. A total of 154 people were affected. 27 of those were children 5 years old or younger. And I do want to mention that although I only covered the outbreaks, the official outbreaks in the US linked to pet food, there's been other reported cases of illness linked to pet food and different types of pet food as well. So why are people getting sick from a food that they don't eat? Some possible modes of transmission include improperly washing your hands after handling adulterated pet food, interacting with an asymptomatic pet, improperly cleaning feeding utensils or food contact surfaces. And kids may eat the food accidentally or not knowing, or may wash the hands after helping feed, may not wash their hands properly after helping feed the family pet. So the home is the last line of defense to protect a family from illness coming from pet food, and education may be a proper intervention. So this leads me to my problem statement, which is consumer perceptions regarding the effects of pet food on human health are unknown. The research questions I will try to answer are: what are current consumer beliefs regarding the impact of pet food on human health? How do consumers get information about pet food safety and safe handling of pet food? What types of safe handling recommendations do consumers want to see on pet food labels? And how can regulators educate consumers about the safety of their pet food? To answer these questions, I conducted surveys of cat and dog owners in the Minneapolis-St. Paul metro area. These were about 5 minutes long and they were anonymous. Some of them were conducted in person at pet stores or feed stores around the cities, but the majority were conducted electronically. And the results were analyzed using Excel. Some questions that were asked included information about hand washing practices, cleaning of food bowls, awareness of recalls, human illnesses, and pet food safety education. When the participants were asked where they mostly did their shopping for pet food, they could choose multiple answers, but the most commonly mentioned included brick and mortar pet stores, online retailers, and grocery stores in that order. Participants were then asked if they wash their hands after feeding certain types of pet food. The yes answers are in blue and the no's are in orange. Some things to note in this chart are the amounts of people that did not wash their hands after handling the first three categories, which were frozen or refrigerated raw food, freeze-dried raw food, and animal part chews, as well as the dried dog food all the way to the right. Sorry, dried pet food all the way to the right. When they were asked about food bowl washing practices, that ranged anywhere from after every meal to once a year. But in general, the consumers that fed raw food tended to wash their bowls more often. When they were asked about human illnesses, a lot of them did believe that people could become ill from pet food. 71% said yes. However, 29% said no, they didn't believe this. And some of the comments made were they just never thought about it or heard of any illnesses. Some said raw food yes, others no. And some said it's the same as human food. 32% of the participants said they received recall notifications. 58% said they currently did not receive any safety or safe handling information. Of those that said yes, some of the sources mentioned were veterinarians, websites, blogs, social media, and the news. And 63% of participants said they were interested in learning more about safe handling education. Those that did not or were not interested say they were confident in their knowledge. Others stated that they had animals all their lives and never got sick. And others said they believed the food that they fed was low risk, so they didn't need any more education. This chart displays the preferred sources of this education by those that wanted to receive more. Some conclusions from this research were that pet owners have a general idea of the importance of safe handling and hand washing practices. However, the majority that fed dry and animal part chews did not wash their hands after handling it. And considering that these foods have been involved in human illness outbreaks, these responses are pretty significant. Some trends observed were that pet owners that fed some sort of raw food or treats were more likely to receive recall notifications, to believe that people can become sick from handling pet food, and to wash their food bowls more often. The majority of the participants were interested in learning about food safety and safe handling. However, they want the information to be clear and provided by a qualified individual or individuals. New federal regulations may help decrease the risk of adulteration. However, education is still necessary to protect the pet owners from foodborne illness caused by pet food. So that's why my recommendations are the following. Feed regulatory agencies should partner with people and organizations closely associated with the pet food industry, such as veterinarians, to perform in-person and media outreach activities. Additional consumer surveys should be conducted to see if opinions are different between pet owners that are active on social media and those that are not. APCO should consider requiring clear and attractive standardized safe handling recommendations in all types of pet food, regardless of perceived risk. And future studies should be conducted to investigate what type of safe handling information is being provided by veterinarians, retail stores, and other consumer sources of pet food education. And now I'd like to thank IFPTI staff and leadership, my mentor, Doug Saunders, the other mentors, the fellows in this year's cohort, my supervisor, Brett Boswell at the Minnesota Department of Agriculture, my coworkers for giving me a lot of good input for this research, my friends and family, and the store owners and pet owners that helped me make this research possible. And now I'll take any of your questions.
Okay, great, Melanie. Thank you very much. So go ahead, participants, if you have any questions, Melanie, go ahead and type those into your Q&A box at the bottom of your screen. And Melanie, we've also got some coming in by email as well. So I'll start asking you one here. So someone wants to know about, currently, do pet food packages have any type of safe handling statements for consumers on their labels now?
There aren't any required statements or anything. The FDA does suggest that some raw food have specific language, but there are no laws or actual requirements to make a company do this.
Okay, got it. And here's another question. Based on your experience and comments that you received while performing your research, what do you believe would be the most effective consumer outreach activities for communicating the importance of pet food safety to consumers?
There's a few that come to mind. One that I always try to push forward, I know at the MDA we've really been trying to get, is some sort of educational activity at the state fair. Since it's so close to where we work and we usually volunteer here, we think it's a perfect opportunity to pass out pamphlets or have little activities for kids. I know there's always a lot of emphasis on animals at these fairs, so I think it's a perfect opportunity for outreach. I also think it'd be really beneficial to information.
Okay, great. And we do have some questions coming in as well on the chat bar here. So someone would like to know whether you asked further about when you asked your interviewees if, what they would consider a qualified source of information. Does that make sense?
Yeah, and that's a great question. I did not ask further because I wanted to keep these surveys short. I had people in person and I wanted to keep them for the 5 minutes, so I did not go further into that.
Okay.
That's a good topic for future questions and research.
Sure. Good. Here's an interesting one, and someone wants to know, how often are you supposed to wash a dog food and water bowl, and how often did most people do that?
I don't know.
Yeah. Yeah.
I don't know, and I'm not a microbiology expert, but I would suggest, I don't know, whenever you start to see it get dirty. At least with my dog, that's what I do. I feed
Yeah.
kibble, so I don't have to do it every day. I know when people feed raw, it tends to be daily or after every meal. So it's, I don't know.
Yeah. Yeah. So it wasn't part of your research, but
Right.
interesting question. Another question, Colorado, maybe it's more of a statement. Colorado has added the requirement for safe handling instructions on raw meat and poultry products intended for pets. Were you aware of that? Is that must be a recent?
I was not.
Yeah, interesting.
I was, yeah, it's good to know.
Yeah, and I know, Melanie, the AFCO conference is coming up, so I'm sure that some of these items will be on agendas at the AFCO conference.
Mhm. Yeah, there is a labeling modernization that's going on right now, and the model bills are going to be revised according to what we think is best for going forward. But this may take a while, so this is a good time to bring out all these concerns or research and ideas to be implemented for the future.
Great. Okay. And then one question here, does the Department of Agriculture randomly test dog food for possible pathogens such as salmonella?
Yeah, we test the MDA tests different types of food. Sometimes they're more focused on a specific type or, yeah, there's a fair amount of random testing.
So a lot of routine testing, it sounds like. Okay, good. Well, at this point, I see no other questions coming in, Melanie. So I think we'll thank you for your presentation, and we'll move on to our next presenter. Thanks, Melanie.
Thanks.
Okay, Charlotte, would you like to present?
Sure, good afternoon.
Looks like you've got control there of the screen.
All right, good afternoon, everybody. Welcome to the IFPTI Fellowship Research Presentation Series. My name is Dr. Charlotte Detmer, and I am a Veterinary Consumer Safety Officer for the Illinois Department of Agriculture. My research was a retrospective study of the farm use of insecticides containing piperonyl butoxide prior to violative residue levels detected in livestock carcasses sampled for the fiscal years 2017 to 2019 FSIS National Residue Program. The use of insecticides is common in animal agriculture to reduce the spread of vector-borne diseases and to improve animal wellness. Parasites can be a significant source of economic loss for producers due to reduced feed efficiency and weight gain, and the loss of carcass value at the time of slaughter. The purpose of my research was to investigate the preliminary factors of a common ingredient that is found in these insecticides that contribute to positive meat residues. This ingredient is known as piperonyl butoxide. Now, piperonyl butoxide does not have any activity against insects by itself. Instead, it heightens the activities of the other active ingredients found in these insecticides, such as pyrethrins, pyrethroids, rotenone, and carbamates. And based on the FSIS National Residue Program, there were 4 carcasses that tested violative for piperonyl butoxide residues in 2017, 8 in 2018, and 2 in 2019. Now, these numbers aren't that high, so why do we care? The United States EPA has categorized the piperonyl butoxide as a group C carcinogen, and this means that it has the potential to cause cancer in humans, but there is little or no human data and limited animal evidence to fully determine its effects. In meat inspection, animals undergo residue testing either because the animal is suspect to contain residues by visual observation, so either because they have injection sites or evident disease processes, or because the carcasses are randomly sampled to be collected to meet quarterly inspection benchmarks. It is impossible for the inspection team to look at an animal and determine if a fly spray was used based on visual observation alone. Therefore, any of these insecticide residues that are detected are either because of random selection or because of secondary residue suspicion. The problem is factors contributing to violative propanol butoxide residues in livestock carcasses from the 2017 to 2019 National Residue Testing Program have not been studied extensively. My research questions that I wanted to find out were, what is the background of the animals that tested positive for propanol butoxide? What was the route of propanol butoxide exposure to livestock? And what is the level of producer knowledge about insecticide use on the livestock farms? I started the study by performing or submitting a FOIA request for all of the residue information. From that information, I contacted the slaughter establishments as a courtesy call to let them know that I was performing the study, and conducted telephone interviews with the livestock producers. With the information that I obtained, I then analyzed and reported the qualitative data. My study population started with just the livestock producers who had carcasses that had violative propanol butoxide residue levels that were detected between 2017 and 2019. But I learned pretty quickly as I was contacting these slaughter establishments for background information that they were also providing valuable information that is also reported in the study. So 8 livestock owners participated in a telephone interview. One of them was a meat processing plant that purchased the animal from a local naturally raised livestock producer and was identified as the livestock owner. And 7 establishments from 5 states also provided background information regarding the residue. 4 of the 7 establishments interviewed stated that they retrospectively questioned if the propanol butoxide exposure occurred at their slaughter establishment. Now, this was not a specific question that I asked them, but this was something that they brought up as we were talking about the background of the residue. One of the establishment owners assumed full responsibility for the residue. And what happened in this circumstance was the establishment owner had applied an insecticide to the livestock pens the morning of slaughter to knock the flies off, to reduce the number of flies on his kill floor. And he had determined that the contamination was the result of poor employee hand washing between handling the skin carcass and touching the hide that had the insecticide present on it. Another establishment also later suspected that potential contamination occurred by the inspection team due to atypical sample handling. So instead of the inspector collecting the muscle sample and putting it directly into the sampling bag, the inspector had taken it over to a workstation, laid it on the countertop, and then put it in the sampling bag. And at that point in time, he had also applied an aerosol insecticide to his kill floor to knock down the number of flies before slaughter had started that morning. All individuals interviewed stated that they were not aware that propanol butoxide was considered to be a chemical risk for meat residues prior to the violative tolerance level. And only 1 livestock producer recognized that propanol butoxide was a chemical component of insecticides before the residue was detected. 7 out of 8 livestock owners financially lost money because of the positive residue. And the only reason it's not 8 out of 8 is because of the meat establishment that I spoke of earlier that took full responsibility for the residue contamination and had paid the livestock owner for the value of that animal. The individual animal values were estimated to range between $500 and $2,500. Additionally, the meat establishments also suffered due from the loss of time spent from processing the animal on the kill floor and the financial income from being unable to further process the condemned carcass into the meat cut. Here's a list of the insecticides that contain piperonil butoxide that were identified on the farm or at the meat establishments around the time of the violative residue. They're the country vet metered insecticide fly spray, the Prozap CT75 and the Prozap LD44Z were identified by either more than one livestock producer or meat establishment to be the insecticide that was present. And aerosolized insecticide sprays were the most commonly mentioned product type. Only 3 livestock owners were able to potentially link a pesticide product to the violative residue. The Prozap CT75 was the aerosol insecticide that was applied to the livestock pens from the slaughter establishment that took responsibility for the residue. The Prozap Insectron CS Poron was applied to the back of the animal by the livestock producer approximately 4 weeks before the animal was delivered to slaughter. And the final one was the Repel-X equine fly spray, which was applied to the animal by a family member of the livestock producer the night before the animal was delivered to the slaughter establishment. All of the insecticides that were on the previous list were all applied to reduce and eliminate food safety concerns for animal welfare considerations and to meet pest control requirements. So conclusions were piperonil butoxide is commonly unknown to be a risk for meat residues, and the identified insecticides did not contain a withdrawal label or a residue warning to alert the applicator of the residue potential. The exception of this was the Repel-X equine fly spray, and that was because it was labeled for use in horses not intended for slaughter and did not have a food animal label. So moving forward, I would recommend that the withdrawal times and residue warning statements should prominently alert the applicators of residue potentials in our food products. Further investigation to determine if meat processing establishments are a definitive source of accidental contamination is really important from the standpoint of food safety concerns and for the standpoint of the financial loss experienced by the producers. Lab testing should also be determined if the residue is a surface contaminant or actually located within the muscle fiber to determine if corrective actions can be performed to salvage that carcass instead of having to condemn it and throw it away. And finally, a development of a carcass-side strip test may be extremely beneficial for use at the establishment to apply to the hide of the animal to determine if an insecticide is present and if additional measures need to be applied as the animal moves through the meat processing. So to end, I'd really like to thank the Illinois Department of Agriculture and the International Food Protection Training Institute staff and leaders for helping me through this fellowship project. And also especially to Dr. Lori Miser, who has been a veterinary mentor of mine from the Illinois Department of Agriculture, who inspired this research topic and who has taught me more than anything I could give her credit for here. So here's a list of my references from the National Residue Program. And with that, I'll take any questions.
Okay, Charlotte, great job. So feel free to type questions into your Q&A box or your chat box, I guess some folks are doing. Well, Charlotte, here's one question for you. Is there currently any research being done to replace piperonil butoxide in insecticides that may be safer?
That is without or was not in the scope of my research. I would hope so, but I'm not really sure because of the low numbers that have been detected. If you remember the slide, and I can go back to it, of the insecticides like pyrethrins and pyrethroids, all of those are also detected for residues, and I didn't look at those numbers to see how many were actually detected. But I would hope so, but I'm not sure if it is a main focus point just from the standpoint of the low numbers.
Okay, great. Here's another question. What is the metabolic fate of piperonyl butoxide in the muscle of cattle? And does anyone measure the degradation of products of piperonyl butoxide so that you can measure the total amount? Sounds like a pretty specific question.
Yeah, that's a really great question. Again, that was out of the scope of my research. That was actually questions whenever I was researching the topic to find out, you know, even from the standpoint of if a fly spray is applied to the hide of the animal, how long does it take to get through the dermis and into the muscle fiber, or if it's sprayed on accidentally on the feet of an animal, if it's ingested and goes through the metabolic process that way, what it would be like. But unfortunately, I couldn't find a lot of research regarding that. But I think that's a great area of research for the future.
Great, thank you. Someone else has a recommendation as well. And have you reached out to your state pesticide regulatory authority to work with them to contact EPA to try to get the notices added to the product's labels?
I have not reached out to this on the state level. When preparing for this research, I had contacted FSIS because their lab program, because that is who all of our residue samples go through to try to obtain some information. And it didn't seem, between the conversations that I had with the lab and the conversations that I've had on other levels, again, I'm not sure if anybody is taking the precedence to put that on there, but that's something that I think direly needs to be addressed to prevent unfortunate and preventable residue levels.
Okay, here's a related question, and so that was kind of on the EPA side, but this question asks, who sets residue limits for pesticides in meat products?
The Food, Drug, and Cosmetic Act has authorized the EPA to set those tolerances or maximum values for currently registered pesticides. That includes pesticides that may not be currently in production but might still be in the environment. So the Food Safety and Inspection Service, it applies those values to the regulatory program. That tolerance level for piperonyl butoxide is 0.1 parts per billion. And again, anytime that the residue level meets 0.1 or exceeds it, the proper disposition for that carcass is to condemn that carcass and the associated parts with it.
Got it. Okay. Another question. You said in your presentation that only 3 livestock owners were able to potentially link a pesticide product to the violative residue. Can you expand upon what potentially link means?
Yeah, and I might actually go back to that slide here. I think it was that one. So here it says that they were able to potentially link it. So so the first one was from the slaughter establishment that took responsibility. The second one, the Prozap Insectrin CS Poron, whenever I talked to the livestock producer, that was the only thing on his farm that he could link that had piperonyl butoxide on it. And again, he had applied it, and it was a topical pour-on that you applied to the dermis. So again, he had applied that approximately 4 weeks before that animal was delivered to slaughter. So it goes back to the question that was asked earlier about the metabolic rate and all of that, and how long does it take to get through the dermis and into the muscle, and how long does it stay there? He had reached out to Prozap, the company, to ask those questions and had never received any final answer from them. And then for the Repel-X equine fly spray, again, that was a potential link. When talking to that livestock producer, apparently only a small amount of that was applied to the animal because the animal had a little bit of a wilder nature about it. So the livestock, the family member couldn't get close enough to thoroughly spray it, but she attempted to. And so from that perspective, it was a potential leak. Again, that was the only thing that would have been applied. So those were the best that they could come up with on where the source of the contamination came from. Great question.
Great, good. And looks like another question, are there policies in place to instruct slaughter facilities on how to avoid muscle contact with pesticides?
Not policies specifically against pesticides, but they do have to address in their hazard analysis regarding different residues. And so if the establishment has determined that pesticide residues are reasonably likely to occur or not reasonably likely to occur, they're supposed to be able to address them about either a program in place or how they're going to prevent it. That being said, again, it's a low number, and it's impossible to detect if fly sprays are used just based on the visual observation alone.
Okay, good. And then I see we have some other recommendations coming in. So we'll make sure we share those with you, Charlotte, so you can see some recommendations from folks in terms of following up on some of the questions. So thank you for those. And at this point, I see no more questions popping in. So Charlotte, we'll just thank you. Great presentation. Thank you very much.
Thank you.
Okay, and now we'll move on to our third presentation of the afternoon, and that would be Bob. Bob, would you like to take it from here?
Yes, thank you, Jerry. Good afternoon, everyone. My name is Bob Luer, and I am a Feed Regulatory Advisor with Minnesota Department of Agriculture. And we are here today to discuss my research topic, relationships between the violative conditions observed at medicated feed manufacturers inspected by the Minnesota Department of Agriculture Commercial Feed Program. So first, let's talk about the background of the study. With the passage of the Food Safety Modernization Act, prevention has become a core element of our food safety system, and inspectional programs all across the country collect data in the form of violative conditions observed during routine inspections. And scientific use of this data can be made to discover relationships between violative conditions, and those can provide opportunities for regulatory training for increased compliance, and also in development of outreach plans to industry. Medicated feed has a large financial impact on production agriculture. Medicated feeds are approved for both disease curative and production enhancing claims. However, there is a risk of creating antimicrobial resistance in both the target species and the environment around the animal being fed the medicated feed. So with this in mind, let's define the problem statement. The relationships between the violative conditions observed at medicated feed manufacturers inspected by the Minnesota Department of Agriculture Commercial Feed Program are not known. So in order to discover these relationships, let's move on to my research questions. First, are there relationships between the violative conditions for firms regulated by the Minnesota Department of Agriculture Commercial Feed Program? Second, what regulatory categories can these relationships be found in? And third, what statistical tools are useful for determining these relationships? So to answer these questions, let's begin with the methodology. First, I obtained all of our inspectional data from the USA Food Safety Program. I sorted to include only medicated feed manufacturers and only the results from inspections related to the current good manufacturing practice regulations, 21 CFR 225-120 to 225-202, also known as the medicated feed GMPs, from the years 2018 and 2019. I then analyzed the data set using the Microsoft Excel function, core. So next, let's discuss the study population. Over the 2-year study period, there were 197 medicated feed manufacturers that were licensed by the state of Minnesota. There were 293 individual initial surveillance inspections conducted during this time, and over that period, there were 80 inspections that had at least one violative observation. So now let's discuss the results. The most frequently cited violative observation was in the drug components category. This category can contain drug control procedures, ensuring that drugs are used only in accordance with label directions or with approvals and regulations, ensuring that drugs are stored in their original closed containers, and the storage and use of bulk drug sources. The second most frequently cited violative observation was in the medicated feed labeling category. And this can include directions for the medicated feed that can provide the end user with specific information regarding the intended dose, weight restrictions, any mixing instructions, and withdrawal time, along with the mandated caution and warning statements. Moving on to the correlation coefficients. This study showed mostly positive relationships. A correlation coefficient of +1 indicates a perfect positive correlation, whereas a correlation coefficient that's closer to 0 indicates no or weak correlation. The strongest correlation in this data set was between drug components and medicated feed labeling. For example, if a firm is unable to use a drug correctly itself, the corresponding violative observation that has the highest correlation in this study was with the inability to adequately label medicated feed for safe and effective use by the end user. The weakest correlations in this study were between equipment and the 3 citations of work and storage areas, drug components, and equipment cleanout. And it should be noted that this data set revealed that over the course of 2 years, the commercial feed program found no violations in the category of 21 CFR 225-158 medicated feed assays. So in conclusion, logical relationships between the strongest correlations represent opportunities for increased regulatory compliance through inspector training and outreach to industry. For example, the second highest correlation in this study was between buildings and grounds and work and storage areas. That would indicate that there is a relationship between firms that are not maintained in a manner to minimize pest and vermin infestation and they're also not likely to keep fertilizer, pesticides, or other toxic materials away from equipment used in the production or storage of medicated feeds. So, recommendations. The most frequent observation in the study period and the highest correlation was found with the category of drug components. Therefore, the Minnesota Department of Agriculture Commercial Feed Program should focus outreach efforts to increase the literacy and awareness of correct medicated feed use. Additionally, correlation studies based on inspectional observations are a useful method for insight into how violative conditions are related in this data set and should be explored further in other food safety programs. Outreach activity performed by the feed program should be developed with the identified correlations in mind to maximize effectiveness. Furthermore, program inspector training and discussions at meetings should be facilitated to identify the impact of the identified correlations. In addition, these findings should be shared with other feed regulatory stakeholders, such as the Association of American Feed Control Officials and the U.S. Food and Drug Administration Center for Veterinary Medicine, specifically for the opportunity for additional research and outreach nationally for increased medicated feed regulatory compliance. Finally, in addition to the previously mentioned organizations, the Association of Food and Drug Officials and the FDA Office of Regulatory Affairs should explore using the methodology outlined in this study to examine the correlations that could be found in many food safety regulatory programs to identify additional research and outreach nationally. And finally, I would like to acknowledge the management of the Minnesota Department of Agriculture Food and Feed Safety Division, specifically Catherine Simon, Division Director, and Rick Manthai, Commercial Feed Program Supervisor, for their encouragement and blessing to pursue this opportunity. The entire IFPTI fellowship team, especially my advisor, Joe Corby, and everyone involved in Cohort 8, Dr. Stephen Stewart of the Minnesota Department of Agriculture for his assistance in obtaining and sorting the data set, my wife Hillary, my daughter Claire, my son Freddie, for the understanding and time it took to complete this fellowship opportunity. And finally, I'd be happy to answer any questions that you might have.
Great, Bob. Thank you very much.
Thanks,
We do have some questions coming in. Here's one. Are medicated feed facilities in Minnesota subjected to increased levels of inspection and sampling than non-medicated feed facilities?
So if I understood the question correctly, are medicated feed manufacturers inspected more than non-medicated feed manufacturers? Simply?
That's what it sounds like, yes.
Okay, thanks, Jerry. The answer would be yes, because we, as part of the Animal Food Regulatory Program standards, we have a risk-based inspection matrix where the manufacturing of medicated feeds is considered to be a higher risk activity, so they are inspected more frequently.
Got it. Okay. And here's a question. Would you expect any differences in your research findings between the larger and the smaller medicated feed manufacturers?
Well, just on my view through the inspection data when I was doing my sorts by facilities and tonnage, there didn't seem to be any correlation with size, and that would be a great question to ask in the future, because we do have that information based off of tonnage taxes that are paid to fund our program. So I think a great additional question could be, running just a violative observation count versus total tonnage tax paid, and that would be an interesting research question to conduct.
Okay, good. And then, of course, your research was conducted for a certain time period. And this question is, do you feel the deficiency probabilities in medicated feed mills could change from year to year?
Yes, I absolutely do think they would, especially because, this again wasn't a question based on, my research, but I think seasonality, especially in a state like Minnesota where we do have such wide seasonal swings of, exterior and interior maintenance, could be definitely affected by the willingness of plant personnel to spend time inside or outside, depending on if they enjoy cold or warm weather.
Got it. Okay. Another question, does AFCO, the American Association of Feed Control Officials, have any outreach publications or efforts that could be utilized to broadcast your research efforts?
Well, I am presenting next week, or in 2 weeks, at the Education and Outreach Seminar through AFCO. I know they do have an outreach and education subcommittee, and after this information is shared with them, I would definitely like to have a conversation with where we could take this information moving forward.
Okay, and I think the questions are starting to slow down, but Bob, was there anything about your research that surprised you?
I think the surprising thing was that the answers seemed to validate gut feelings that I had, and that was one of the reasons why I wanted to undertake this project, was to see if it was just something that I could see as an individual inspector, or is this something that we're seeing across the entire state? And I believe with the answers that I got, it really is something that seems to be a common issue when we do see certain violations that other ones come along on our violative observation lists.
And does your research, do you think your research could apply to other types of regulatory situations like food inspections or others?
Yeah, I think there's no reason why this couldn't be part of any regulatory agency, whether that be pet food label review or any sanitarian work, from environmental sanitarians to health sanitarians to medical device inspections, because the concept itself is very simple. It's just a matter of getting a database set up and running the calculations.
Got it. Okay, and I don't see other questions coming in, Bob, so we'll wrap it up there. So thank you very much for your presentation.
All right, and thank you, Jerry.
Okay. All right, well, thank you all for attending this session. As a reminder, AFPTI will post these webinars and the slides on its website next week, so watch for that. And you'll also be able to find the full research project papers on IFPTI's website for all of the fellows papers. I would like to thank Melanie, Charlotte, and Bob. I hope you all can join us again next week for more fellowship presentations. Remember to register separately for that session on the AFPTI e-News. And until then, we'll see you next week.